there's a lovely quote in the book. I know it's not your quote, but it says it's easy to make perfect decisions with imperfect information, but medicine asks you to make perfect decisions with imperfect information. And this is about risk versus harm. Talk to us about breast cancer survivors and whether estrogen can help them, and is it safe, and how they should make that informed decision with their doctors.
Let me say again, they should make it with their doctors, absolutely. But that question has been asked by 15 studies of that question. Women who were given hormones after being treated for breast cancer compared to women who were treated for breast cancer and didn't get hormones. 15 studies published in the medical literature between 1995 and 2013. And all 15 studies show no increased risk of recurrence among the women who were given hormones. And by the way, pregnancy after a diagnosis of breast cancer, which raises the circulating level of estrogen and progesterone by at least tenfold, has no increased risk of recurrence associated with the pregnancy. And that was true even among women who were BRCA positive, women who carried the gene mutation, got breast cancer, and were treated for their breast cancer. And even they could get pregnant after breast cancer and not have an increased risk of recurrence. And an international study published last year found that that's true even for women who had estrogen receptor positive breast cancer. And so the question is, well, if there are 15 studies like that, why doesn't everybody accept that? And the answer is, of the 15 studies, 14 were called observational studies, prospective observational studies, meaning, yes, this was done prospectively. Women received hormones, some did, some didn't get hormones, and they were followed for long periods of time, up to 26 years, without seeing an increase. And parenthetically, 3 studies found a decreased risk of recurrence among the women who received hormones. But people argue, if it isn't prospectively randomized, it's not a good study. Well, I have 2 answers for that. One is one of the 15 studies, called the Stockholm study, that not inappropriately was organized in Stockholm, Sweden, was a prospective randomized study followed for 10 years that also showed no increased risk of recurrence after treatment for breast cancer among women who were randomized to receive hormones. But the other answer is, when you look at observational studies and compare them to randomized controlled studies, and this is elaborated on in the book, a well-controlled observational study has the same validity as a well-controlled randomized study. And if you look 20 years in the future after publication, the results of observational studies are still valid in 87% of observational studies and in 85% of randomized studies. Now, I mentioned there were 15 studies, and I left out one. There is one study called the HABITS trial, and HABITS is an acronym for hormone replacement therapy after breast cancer. Is it safe? This was also done in Sweden, but not the Stockholm study, and this also was a randomized trial. And this trial found an increased risk of breast cancer recurrence. And everyone who is antagonistic to hormone replacement therapy quotes only the HABITS trial out of all the 16 that have been reported. So let's look at the HABITS trial. First of all, the follow-up was 2.1 years. That's not a very long time. And I mentioned that some of the other studies reported between 1995 and 2013 went on as long as 26 years. More importantly, if you're going to do a study where you're going to randomize patients or allocate patients after breast cancer to receive hormones or not receive hormones, you want to know whether any of those patients had recurrence of breast cancer before entering the trial. Habits didn't do that. They did no pre-study evaluation. They didn't even do a pre-study mammogram on patients entered into that study. In addition, if the recurrence is real, you'd expect it to be most pronounced among women whose breast cancer had lymph node positivity. And there was no increased risk of recurrence among women who had positive lymph nodes. There was also no increased risk of metastatic breast cancer and no increased risk of death from breast cancer among the women who were randomized to get hormones. And yet that study is the one of the 16 that is often referred to.